Record.
Wait, I can't see you.
Let's see that. There we go.
There we go. Okay. All right. Now, I got to get on TikTok. Let's see how this goes. Because I don't often do this part. So, hope you have topics.
I do not. I scrolled Reddit for a bit. Hopefully, that's lots of questions, and we can always end, I guess, early if we need to. But the only one I'm really seeing is some doctors aren't prescribing anymore. Like they're just firing patients, or not even firing them. They're just like they call for their refill. Like we don't do that anymore.
Oh.
And
okay.
Shortages of 10 to 15 they're going to be short for a while. That's it.
Wait, let me see if I can figure out how to do live here.
Yeah.
Okay. I think. Nope. That is not. Hold on. I'm getting there. Let me see. No. Hold on, because usually I can do it, and it's not. You know, when I don't want to go live, it like pops up for me to go live. So let's see. Hold on. There we go. Okay. What do we title it? GLP1 chat?
Yep, that'll work.
GLP1 and lifestyle medicine. How about that? Getting there.
Oh, no, apparently we're on Facebook already, so we're good.
Okay. Then we'll kick us off.
Yeah. There we go. And we're caught up and mute myself. Every time it wants me to mute.
All right, let's see. Yes. All right, I think we're about to be live on TikTok, maybe. Oh my goodness. It needs me to confirm how old I am.
You're over 13.
Definitely over the age. Let's go. Goodness. Okay. Oh my goodness. It's still giving me trouble.
Always does.
I know, like.
Yeah, it's super easy. Just do this. And then I think we spent like an hour and a half trying to do it, and like that didn't work.
Yeah. Like, well, it's let me go live, of course, when I've been on with her, but now to try to go live by myself, it's going to be tricky. So those of you joining us on Facebook, welcome. Neil and I are trying to run the show without Dr. Mo today, and we're getting there.
Slowly. Permissions, and then the permissions don't work.
Yes.
It's just like sometimes with the video visits, like they give permission for their mic to talk to us, and then their mic's muted, like on 3 different levels.
Here we go.
Down. Oh my goodness.
All right, we might be going live. Okay. Hello, all. Hope you can, let's see, I'm going to fix my camera. There we go. All right. I don't have mine set up as close as Dr. Mo does, so if I'm looking two different places. So, hello, I am Courtney Fairweather. I am a nurse practitioner with Active Medical Solutions. Dr. Mo is our fearless leader, and she is gone today. I am here with Neil. You can't see Neil's face, but you will hear his voice. We are also live on Facebook, on our Active Medical Solution Friends and Wellness Lounge. Is that what it's called? It's our public group.
Yes, AMS Friends and Wellness.
AMS Friends and Wellness, if you choose to look on Facebook. So welcome all. Usually Dr. Mo is here to lead us. So I'm going to let Neil kick us off with our disclaimers that we always start with.
Awesome. So welcome, like Courtney said, everybody to another Monday Motivation without Mo. Welcome. First, this is not medical advice. It's not relationship advice or financial advice. It's just us talking about GLP-1s, kind of typical things that are going on with our patients, how we treat some of those things and ideas. If you have a specific concern, you should probably ask your primary care doctor. And it's not a regular group, but it's still a big group. It's not HIPAA compliance based. So if you want people knowing your business right here, don't say it right here. Because we are on the internet and people get crazy. But welcome. If you have any questions about GLP-1s, how we treat our patients, our experiences with them, Courtney and I have both been on them. Feel free to ask. We can help with talking about side effects, doses changing, switching meds, or kind of anything else you see in the news with regarding these medications. We can talk about Ozempic butt. We can talk about constipation. we can talk about gastroparesis. Yeah, I saw it was an Instagram post by like a doctor, and he was saying how dangerous that all GLP-1s are, that it's poison for your body. And basically, he's like, it slows down your gut and it does all these things. I'm like, yep, that's exactly what it does. Okay.
Yep. Yeah,
Please tell me you're not practicing somewhere, or you're like he was a doctor, but I don't know if he was a doctor of who knows what.
And again, even with like trusted colleagues that I trust for many, many things, they're so unclear about what these medications do and how they act and the benefits that they listen to the other news reports rather than like experience of patients or people who have been on these or people who specialize in using these medications and have used them with a lot of patients. So I often say, I think that's where our practice varies, is that although we do focus on other things besides GLP-1, we kind of focus on lifestyle in general, but a large part of our practice is GLP-1s. It allows us the time to really get to know these medications extremely well, because we're not trying to focus on your high blood pressure, although we want that under control, but we're not having to see, the number of patients per hour that are required of many practices. You don't have to wait to get an appointment to get in with us. You have unlimited access to us. So we're very adept at managing any side effects and getting to know our patients and their goals really, really well, where a lot of offices just don't have time to do that. So I think that's one of the ways that we specialize.
We don't have time, and then to either do it, and they don't have time to learn it.
Yeah.
There's a steep learning curve, and then the follow-up there's a lot more follow-up than you would typically have with someone just throwing someone on metformin or a blood pressure medication. Like you're going to say, here, take this and check your blood pressure every day, and if it gets out of these ranges, call me. Otherwise, good luck.
Yeah,
see you in 9 days.
If I'm trying to touch my phone, it's just because I'm trying to invite Neil, and it's not really popping up where I can do that. So
yeah, keep waiting. That's okay. As long as they can hear me on yours, that's cool.
Yeah, as long as they can hear. Now it won't let me get your thing off the screen. Okay.
Did you put us on the on YouTube as well?
I did not. I hope that Gil did.
Okay.
I hope. That's what was supposed to happen. Okay. Oh, I don't have the feature to unlock.
For live, for me?
Yeah, that's okay.
Maybe that's over 10,000 visitors.
You have to have you have to have been live for like a certain amount of time or on 3 separate days. There we go. So it doesn't count that I've been live with Dr. Mo. It's if I do my own. So, okay. In the next couple of days, we'll meet a couple of those requirements, and we'll meet the rest by the time she goes on the next vacation. So, people, please chime in with any questions. Anything you've had come up a lot over the past week, Neil?
Just some shortages. So there's been some shortages of it's pretty much been Mounjaro, but there has been some Zepbound. It's the bigger doses, the 10, the 12.5, and the 15. And one of the patients was told by the pharmacy it won't be until April when they're restocked for 15 milligrams of Mounjaro. And she had called every HEB and I think Walgreens and CVS in Austin.
Oh, yeah.
That was near her, and even ones by me. So with no luck. So we're gonna give it a go and give it a try to I'm like, okay, let's check Walmart. I'm like, I see nothing but good things on Reddit for Walmart. One with allowing people to use the coupon without giving them a hard time. And their supply seems good. I mean, the next alternative is Lilly Direct, but I'm assuming they're going to have the same issues with shortages. But I have not seen that yet.
Yeah, I agree. I had someone that had called like 10 pharmacies, and we finally just had to settle on a different dose. I had someone else that we had to go way down to find a dose, to not go without medications.
Yeah.
And then I did have recently, just over the weekend, someone that wanted to start Wegovy. Insurance was approved for Wegovy, but of course, starting doses are difficult to find. You can find starting doses at Express Scripts, but you have to get 90 days worth. So, yeah, so I'm like, really, really frustrating. But, if that's the only way we can get it with insurance approval, if we have to, augment that with some compound for a short period of time to get to a sufficient dose that is available locally or what have you, I think that's probably another unique thing with our practices. We are willing to try lots of different things to get you to an optimal dose. And, if we need to augment or help you search different pharmacies, help you call your insurance company, what have you, we're definitely willing to do that. So, um, and I think this person did actually order compound for a short period of time until Express Scripts could get it to them. So they may have leftover of that to like augment the pen
Yeah.
if needed. Um, so we'll work with them closely. I did also hear, I had not heard, another kind of popular practice that I think is a lot online offers oral tirzepatide.
Well, we do have that one pharmacy we used to use that had oral tirzepatide and semaglutide. I don't
Yeah.
think anybody's ever used it because it's about the same amount of money as the injectable, and the injectable is far superior.
Yeah. So we're going to see,
Um,
because this person's particular question was, could they start at, rather than starting at the lowest dose of injectable, could they go ahead and start at the next up dose since they had already had some tirzepatide? So, I, yes, because they've been on oral tirzepatide without any side effects. So we're going to see how that goes. We'll see how that transition goes from oral to
yeah,
injectable because we've not had that yet. That's going to be,
that's new to me. Yeah, I'd probably, if it was me doing it for myself, I would probably take like a half a dose. Like, I would do like 2.5, the same dose injectable, wait like 3 days, and then take the other half of my dose just to make sure. Because, it's not really equivalent with semaglutide. Like the doses are really all over the place.
yeah, yeah, it'll
Um,
be, it'll be interesting to see. We'll definitely keep a close watch. So,
no, that'll be
but
interesting to see.
yeah, shortages have been a big problem for those people that are able to be on brand name medications. And shortages have been, I mean, there was a very brief period of time where we had no issues with shortages at all, but that was brief. Aside from that, it's been hit and miss either at your local pharmacy or switching pharmacies or what have you that make it difficult.
The Wegovy one is the one that's really incredible. How long it's gone on.
Oh, approaching 2 years?
Yeah, for that low dose, it's just incredible that they haven't been able to fix that yet.
Yeah, and consider, I mean, that shortage started like shortly after the medication came out, like almost like really quickly after it was approved for weight loss and then branded as Wegovy. Within just a few months, the starting doses were listed on back order and have been ever since. Like they've never come off of it.
Yeah,
Just
luckily we have compounded and we can augment or fix that.
right.
And that's probably
Yeah.
what I do. I don't know if I'd even order the starter dose initially with my like 0.25 for 3 months. I probably would just I'll wait a month, maybe 2 months, and then order. At least get to a
Yeah.
reasonable dose.
I know. It's kind of crazy, but they wanted to get started and um I can understand that. Once you've decided on a treatment plan, like we're all ready to get started, right? Like everybody's ready to get going, which
Yeah.
is understandable.
Victor on Facebook's a new patient and has high blood pressure. I hope it goes away with this new opportunity and new journey. It might.
Yeah.
Sometimes it's more of a genetic thing. You may need to be on a little something still. We have had a large number of patients completely come off their blood pressure medications.
Yeah.
They say they can be affected by the absorption. I've never really seen that. I haven't had to tell anybody to go up on their medicines to control their blood pressure. Everyone's just kind of gotten off them. Well,
Yeah.
people have gotten off them, never had to go up, which is great.
Yeah. Yeah. My husband was had to start blood pressure medicine at the same time that he started weight loss medication because that's often what you find, right? You go to the doctor for a physical for the first time in however many years, and learn that you have all of these health problems and need to be on medication. So shortly after being able to start on semaglutide on Wegovy, he was had lost enough weight to really decrease his blood pressure to, okay, sometimes his blood pressure is a little elevated, in particular at work in a stressful environment, but otherwise on a regular daily basis, he doesn't have to take anything, which is, great. And he's like approaching a healthy BMI, which has probably not happened since junior high.
That's awesome. Yeah, I don't know my blood pressure is at work. I guess I need to check it mid shift one time.
Yeah. Yeah. No, I
Figure
don't want to
it
know. Unless we could have checked it yesterday. Maybe our blood pressure would have been normal
It would
yesterday.
have been normal yesterday. It was a nice day. I
Really
love
nice.
daylight. I hate daylight savings time, but it was actually made the day kind of nice because everyone
Uh,
was still sleepy and groggy.
it was a really long 12 hours, but a welcome surprise. So, those of you that don't know, Neil, myself, Dr. Mo, Dr. Gossman, Dr. Galdamez, who are all in our practice, and Brandon, who has
And
joined our
Brandon,
practice,
a little bit of
and
Brandon.
Amanda, who lives up north but used to live here. We all have ER background. The five of us that live here still, or six of us that live here still currently work in the ER. Seven. Now we're up to seven. Okay, there's
Yeah.
8 total. Uh, Still work in the ER doing shifts, and Amanda now does some other stuff up north, but we all have ER backgrounds. Neil and I and Dr. Galdamez currently work shifts in the same ER, so we're not just like figureheads that don't know one another. We've worked for, gosh, Neil, what year did you graduate? Because you came on.
It's like 11, like 2013 ish, I think, something like that.
Yeah, so Neil joined me in the ER as nurse practitioner right out of NP school. I snatched him up quickly,
He
and
stole me from another group.
I did. I stole him as quickly as I could, and he joined. Dr. Mo was a full-time night shift provider for many, many years, and Neil joined her to the dark side and worked night shift for a number of years. He does not do that any longer, and has been able to decrease his ER shifts, which is always nice. But that is our background, and then kind of how we started lifestyle medicine. Uh, Kind of by chance. So I don't. When did you first use semaglutide, Neil?
My HRT doctor just had mentioned it a couple times when I was in there. She's like, patients are losing weight. And I'm like, I don't know if I really need that. And she had some samples. And then she's like, here, I'll just send a script. Get it if you want. It's only like $150 for like 3 months. I'm like, okay, let's give that a go. So I tried it. And like literally, I expected it like the next day kind of thing. Like literally within an hour, I'm like, my appetite's gone. Like that's super weird.
Yeah.
It was really incredible. And at the same time, I think kind of everybody was learning about like Manjaro.
Yeah.
So it just kind of happened to be a coincidence, like right around the same amount at the same time.
Yeah. So Dr. Mo and I have been friends for a number of years, but have also tried as many diet plans that are out there. She's a nutritionist. Dr. Mo's a sports nutritionist. Neil has a nutrition background as well. So if there is a diet out there to follow, we have all tried to follow it and stuck to it for at least a period of time. And my husband was kind of at a health crisis point, and his physician, his primary care, offered Wegovy, which was the first time I had ever heard of it. And like immediately he started losing weight. So the next time I went into our primary care, Mounjaro was out at that time, and I said, I got to do something. No, I don't have as much weight to lose as my husband, but I've struggled over these, 15 to 20 pounds for over a decade, and I would gain and lose and regain the same 15 pounds over and over and over. So I, broke down, got the Mounjaro, and texted Mo and said, I'm starting this. And she immediately was like, yep, let me get it too. So, and within a month of both of us starting and realizing how good it was, we decided to learn how to prescribe it and how to help people. And that's been a year and a half, approaching 2 years. And we've been able to successfully help a lot of people, I think.
Yeah, I think I started prescribing it to help, like to prescribe it for people in the ER that wanted it. And then it
Yeah,
turned into way more.
I know. I think we all got on the original platform that we were on as a telehealth platform. And we just kind of got on there. I think just like, let's dabble in this and like see how it goes, see how this, I don't think any of us anticipated that we were going to enjoy it or that we would be able to really connect with patients in the way that we're able to. Um, I think we kind of saw it as like something we do every now and then on our days off. And here we are doing
Now it
lifestyle
turned
medicine.
into 4 extra hours after every shift too.
Yeah. Yeah, it quickly snowballed. At the time, there was a really, really good coupon out that no one was kind of monitoring, and so um, it really exploded. And since then, we have had to invent solutions that it was easy. It was really easy when we first started. It was all just brand name script.
I mean, I'm
Brilliant.
glad that Eli Lilly let people kind of abuse that coupon initially
Absolutely.
because without it, I don't think Manjaro would have the following it does. Like, I mean, Ozempic, Bud, Wegovy, that kind of stuff, they're just not accessible or around. You can't get them. So I don't think it would have exploded like it has.
No, I agree. And I think, even though we're not able to oftentimes use the brand name medication, people seeing other people's success and saying, I want something like that. What do I do to get something like that? If this particular thing is not available, what is and what can I do? Um, it can I don't know. I think I'm such a believer in so many of the benefits, not just the weight loss, but some of the mental health aspects and the food freedom and quieting the food noise and just having a better relationship with food. Not for those of you who've never experienced it, but living your life like constantly run by food, the freedom from that and how much freer you are just in general to live a life that's not preoccupied by food is such a huge benefit. Um, that's why we're doing this, right? Because we believe firmly in what we're doing.
Let's see who wrote that.
Any questions popping up?
Just on Facebook, Rachel, when she picked up her script at HB last month, they ran the manufacturer coupon and it only cost her $25. Awesome.
Wow.
She didn't have a coupon; they just totally kicked it in. Yeah, sometimes they just apply it, and I think it's just so they don't waste time. Like with you coming in and here's my coupon, and then they have to rerun it. They just kind of get one and run it, which is great. And I'm glad actually that it's working again because we have such these issues with that ransomware that some stuff was still not working, even though it was supposed to be working. And I think it's somewhat resolved. I haven't really seen any posts on as many posts on Reddit about it as there was. Like it was just nonstop. And some of it was like pharmacy staff. They're like, we can't do this. And I know you want your Zepbound or whatever, and we want to give it to you, but it's not just your Zepbound. It's like blood thinners, like Eliquis for like
Yeah.
PEs and like other heart issues and stroke. And they can't they can't use their coupon either. Like they need this too.
Yeah. Yeah, you're right. It's been difficult kind of all around. And even if like in the past you've used the coupon, here's one tip. If you've used the coupon successfully or your prior authorization successfully, and now you go to the pharmacy and they say, we can't run this or whatever, sometimes it just takes asking for a different person who might be more experienced with putting in those things, or is willing to take the extra step or work with you. Um, is it I mentioned last week, it happened to me recently that I went to pick up my medication and they said, looks like your insurance doesn't want to pay. And I was like, oh no, I have a prior authorization. I can show it to you. And whoever was running at this time ran it successfully. And I got messages yesterday that two of my patients, same thing. The pharmacy was telling them you need prior authorization. We have prior authorization. It was approved. Like, what's the problem? So it's going to be going back in with personnel, perhaps showing them that letter. A next step would be obviously calling your insurance and saying, hey, can you let the pharmacy know? Yeah, those are,
They're not going to let them know. They don't want to pay for it. They're just going to do everything they can to not pay for it. If you skip a month, skip a day.
I know. It's, yeah. Yes, Lee Rod, we agree. Happy to be able to breathe with pants on now. Agreed. The ability to like sit down in jeans and eat a meal and not like, well, one, you're not typically overeating as we did in the past, but being comfortable with non-elastic waist pants is a big benefit. I agree.
I don't know. I lived in scrubs for a long time, so it really didn't matter.
Yeah, I'm much more comfortable still in elastic waist because I've lived in scrubs since like 1997, somewhere in there. Let's see. Anybody have any other questions?
Speaking of Lee Rod on there, yeah, she's one of the ones that came to us because her doctor, like, here's your bottle, get out. Best of
Oh,
luck. I don't know. I was talking with someone over the weekend. One of the staff members knew I did this, so she was just asking me questions like what she should do in the beginning because is there a cousin or a friend of hers like is a nurse practitioner and prescribes this, and we were talking about it. And then she just asked me, yep, like how, like, what we charge. And she was asking questions. And I'm like, how much is she going to charge you? And I'm like, no, what are you doing? It was like $450 for the first month of like semaglutide.
oh wow.
And you have to go, and that's not even the biggest thing. Like, okay, that's kind of expensive, but you're starting, I guess. You have to go and get your shots every week.
Oh, you have to physically go
You
there.
gotta go there. I'm like, that alone makes me not want to go to you. I don't care what your price is. I don't care if it's $10 a week. I don't want to go. I have to make an appointment and go get a shot, and I'm like, so I was showing her our stuff, and I'm like, you do absolutely not have to come with me. I'm like, you can ask me questions. I will help guide you. I'm like, but that price is insane for the first month.
Yeah. And going there, like that entails
Mm-hmm.
like you actually gotta like put on clothes and like fix your hair. Like that's a big, and you gotta plan around it. I don't know, physically showing up somewhere, like you
Mm-hmm.
gotta plan around that versus like we tell our patients. So we are our practice is asynchronous telehealth, meaning you send us it's a HIPAA compliant text space, but you send us a group text and our excellent support staff grabs the message and plugs it in where it needs to. You can ask to speak to one of us, and our wonderful support staff will put it on our spreadsheet, and one of us will chime in the next time that we are on shift. But the benefit is if you roll over and wake up at 2 o'clock in the morning and go, "Oh my gosh, my shot day is tomorrow, and I think I forgot to ask for a refill." Yeah, type it in the text message, and someone will grab it within a few hours.
Yeah,
Um,
depending on the time, it might be like at 1 in the morning.
Right. Yes. Yes. Someone may respond to you at 1 in the morning, so use silence. But our support staffs start very early in the morning and go until very late at night. So typically response times are very low. And if you need a provider for something, that response time is typically within 12 to 24 hours, depending on our shift life, but typically much quicker, um, depending on time of day, I suppose, but always within 24 hours that one of us is going to respond to whatever you need. And our support staff know how to handle a lot of things without having to grab us, but they grab us when needed. Yes, Lee, right. I agree. If I have to leave the house, I'm not interested. I think someone recently asked us if we would start or if we would consider adding on other things to our practice, which we definitely would, and we are. But some of those things were like going to people's houses. No, no, we're not. We're not going to people's houses.
There's companies that do that. They'll come like bring your meds to you and teach you how yourself to give the shot. They are unbelievably expensive.
They are unbelievably expensive, and if we chose to practice that way, we would have to change a lot of things about our practice. So let's see who can remember our states because we serve a lot of states now. Let's
We
see if Neil
do.
can chime them off.
Oh my goodness, I'm not gonna be able to do it. Alabama, Arizona, Ohio, Michigan, Wisconsin, New York, Virginia, Tennessee, Florida, Texas, Louisiana. Ooh, who else did I?
Indiana,
Indiana. I got Indiana. It's all right there.
all in that area. So,
Oh, I didn't
and
miss
we don't live in all of those states, so we could not physically go to people's houses. And even in Texas, like we all live in a pretty close proximity geographical area, so going to all of the people that we serve would be an impossible task. So,
Yeah, I
um,
think you don't need us. We're happy to walk you through it. You can watch a video a few times, give yourself a shot. I mean, I don't know how many patients are terrified of needles and either like have messaged like, okay, I drew it up and it took me an hour to do it, but I did it. And they're like, that was super easy. And they never have another problem again. That, you're raised or born and you go to the doctor only like you're young and you only go to get shots. Even if you're
yeah,
sick, at least when I was a kid, oh, you get strep throat, you're getting another shot.
yeah,
So, you associate shots as bad. They hurt. They used big needles back then. This is a teeny tiny little insulin syringe needle. It does not, you don't even feel it. It's
yeah.
nothing. It's a needle still. So,
Yeah, but getting over that, I often tell people do it the first time, and after that, you really won't have a problem. It's the whole thought of like
yeah,
injecting yourself with something, but most people do it without any real problems at all.
have someone else do it. The neighbor, your friend, someone in the house, like it's stabbing, whatever.
Yeah, but you don't need us physically there. We have lots of videos, we have lots of instructions, and again, you have unlimited access. If you go, I know y'all told me this, and I know you told me this 15 times, but will you just verify this dose with me? Will you just look and make sure that this is the correct amount and this is how I'm supposed to do it? And we'll go, absolutely. Message and we'll find out.
I'd rather you do that than overdose. Yeah, message me 100 times to verify it.
Yep.
Take pictures, video, different angles,
Whatever. Yeah. If you need to
send
take a
me
video, if you need to take a picture, if you need to, whatever you need to do, if you need to have your neighbor come over and help you, and message us, then yep, please ask away, and we will help you get through that hurdle for certain.
All right, so 2 are on Facebook. Good afternoon, Colleen. Welcome, welcome. Thank you. We are awesome. I appreciate that.
Thanks.
Rachel saying that she encourages anybody who gets denied by insurance to appeal. She has to appeal every single time she does a dose change with Monjuro. That's annoying.
That is annoying. But yes, I agree. If you get, especially now, I will say if you get denied because your insurance company will not approve brand name Mounjaro or Ozempic because you do not have type 2 diabetes, appealing that may not be helpful. But if your insurance company does list that they cover weight loss medications and you know you meet that requirement, many times they will still deny the prior authorization on the first pass go through. In those instances, appeal does work. I don't know why. I don't know if another person has to look at it. I don't know if we got to type in some different numbers. I don't know why, but oftentimes those will go through on appeal.
They are betting on the fact that your doctor will not do an appeal, because a lot of doctors will not. I see on Reddit all the time, my doctor will not do an appeal, and they're looking for someone to go to who will. On TikTok, I've seen the same. Same thing. My doctor won't do an appeal. That's what they're betting on, because you had to do an appeal, Courtney.
I did. I had to do an appeal for my husband and they had already covered my husband's for over a year. And mine, we knew I fit the requirement. I mean, it's spelled out there what the requirement is. We knew I fit that requirement.
And so did he, easily. And they still didn't want to do it.
No. And I know from one of our physical employees that works with us, and we know that our group health plan does cover Wegovy, but her primary care won't even attempt a prior authorization.
Mm-hmm.
And I can understand to a certain extent, prior authorizations are exhausting. If you have a physical, I mean, we have to employ someone to do our prior authorizations for us. If you have a physical office, it would require at least one, if not multiple full-time employees just to do prior authorizations. I mean, we have one specialist for prior authorizations that's a full-time job. And we do have to charge for those.
Yeah, and that's just for regular insurance, which I think is tremendously easier than like government insurance, like TRICARE.
Oh,
their process is a nightmare because they want you to go away.
Yes, I don't know if we've been successful with them at all.
We have.
Okay.
I think there was one early on that we did an appeal. We didn't change anything, and they literally oh, it's approved. Why is it approved this time?
Great.
Yeah. What?
Happy.
Let's see here. Lisa over on YouTube. You guys are really helpful, especially showing the needle amount. Made me feel very confident. I did the right amount. Thank you. Yeah, I mean, we want you to feel comfortable and confident. Like she said, 100 messages 100 times. Don't overdose, please.
Yeah.
It's a
that, and we have for our patients, we also have a private app that you can use, but it has you can post questions on there, get other patients' opinions. But then up at the top of that app for our patients, there's a little classroom link that has lots of modules. And there's a lot of things on there: tips, tricks, protein, diet samples, side effect questions. I took pictures because one thing that we get a lot is when people first get their medicine and they look at the vial and they go, there's no way. There's no way that there's 4 shots. There's no way that the pharmacy sent me enough medication. So I actually took pictures of this is what it looks like in a vial. This is what it looks like in your syringe. This is what it looks like in a medicine cup, because it looks like a drop. I mean, 100 units, 1 milliliter. It looks like a drop in like a full medicine cup. So if you think about a regular size medicine cup that you would take cough medicine out of, that is 30 milliliters. So oftentimes what you get from the pharmacy is 1. So think about 1/30. It literally looks, I mean, it barely lines the bottom of your medicine cup. Yep. That's all it takes. It's a very concentrated medication. You're going to use a tiny, tiny, tiny amount of that medication per week.
Yeah, it looks like an eraser head. It's about that big. It's like nothing.
Yeah, it looks like nothing. And then other questions that we get a lot of is, as your dose change, sometimes the concentration of medication changes. So it'll be this really, really weird thing where your dose goes up, but your units on the syringe goes down. Again, message us. We'll talk you through that. We will show you examples of what that, how that works, what that looks like. And I understand it's very, very, very confusing. And I am happy to break it down to basics that, uh, Tylenol, the same medication could be 160 milligrams in 5 milliliters, or it could be 80 milligrams in 1.25 milliliters, or it could be 325 milligrams in one tablet or 500 milligrams in one tablet. It's all the same, just different concentrations, and compound medication is the same. It's the same medication, just very different different concentrations. But I'm happy to walk people through that because I get it. It's really tricky, very tricky.
You were talking about like our school, like so the app is school, where patients can go and learn a bunch of stuff, communicate with each other, recipes from Sandra. Plus, we have these, and we have weekly meeting with our regular patients on Wednesdays. I was the girl at work I was talking to about. She's like, "Do you guys do all that extra stuff?" Uh huh. Yep.
Mhm.
You can ask. I'm like, so you don't. I know you know me, and you can ask me lots of questions anytime you want. I'm like, but you don't have to. Like, you can pop on here and message me, and I'll message you back at 2 a.m. Like if you're on an overnight shift, I
Yeah.
can help you then. Um, she's like, yeah, because their lady's like, here, just you go in there, get your shot, you leave. Nothing
Yeah.
else.
Yeah. Yes. So that is, so we do two of these like live TikToks, and we're on Facebook and YouTube live twice a week, Mondays and Tuesdays at 1 o'clock, usually with Dr. Mo, who's much more entertaining than Neil and I. Um, those are public. And then once a week on Wednesdays at 7, we have private just for our patients. So we can get a little more intense. If they're comfortable sharing, and I share with people all the time, if you want to post a question on our private website school and say, could you answer this on your next live? We leave them on our website, on our school link for our patients. They can go back and watch those later. So I'm like, if something's not ever clear in text and it's not time for a video visit, and you want it answered, like, or you want various opinions, you want to hear from more than one provider, you have access to all of us all the time. Um, I mean, we're, as providers, we're in constant contact with, hey, have you guys seen this or heard this, or this is something new that I haven't seen, but is maybe someone else has. And we all work closely together. But on any given Wednesday night at 7 o'clock, if you had a particular question that wasn't getting conveyed very well through text, you typically have minimum 2, but usually 4 of us providers, sometimes 5 or 6, that are live on that, and we'll all be happy to chime in with an answer for you. So that is an added benefit that we do for our patients.
Who wrote that one? Facebook. Oh, it's Colleen. Yearly blood work. She just had yearly blood work. It was wonderful. LDL is 49, HDL is 75. Oh my God.
Wow.
That's the best I've ever seen, I think. Colleen, that's an insane HDL. And she's 61 years old. Yay, Wegovy. Yeah, semaglutide is what I use. And after years of like adjusting my diet, fish oil, like other supplements, because I really didn't want to be on a statin, within 4 months, semaglutide fixed my cholesterol.
Yeah.
It didn't raise my HDL very much, just a little bit. I don't think it was time. But my total cholesterol, LDL, triglycerides, everything came down.
Yeah, same. I had to get my lab work from before I started any GLP1s to get insurance to approve, because mine's been borderline. I'm sure it's, family history, but in genetics, mine has been borderline since I was in my like early 20s, when weight was not a problem. And I certainly wasn't going to start on any statins, prior to having children. It's not recommended. But I knew that as I, was out of childbearing ages, that they would be asking me to start a statin. And so before I lost the weight and got to a much healthier BMI, they were definitely, okay, this goes up anymore, it's time to start a statin. We no longer have to have that conversation.
Thank
Which is
God.
nice.
No one wants to start a statin, or I don't want to prescribe a statin.
No,
So
I'd rather not.
Lee Rod was saying, and this is why I'm not a nurse. Yeah, even the nurses sometimes get confused with for these meds that I've taken care of, like mLs, units, milligrams. Like it can get confusing, especially when every pharmacy uses a different concentration.
Yeah.
And some do something weird. Instead of like a straight up 5 milligrams in an ml, it's like 5.1.
Yes.
Or it's 17 milligrams, which is like, why would you choose that number? Because then you're taking half a unit, which makes no sense. But that's why we're here.
They up that's yeah, or they sell, they dispense like something crazy like 34. They'll dispense
Yeah.
34 milligrams. Thank you. That isn't an equal amount for any dose. You're going to have some left over. So,
Yeah.
but I
Or,
get it.
really short dose.
Yeah, I get it. They don't want to break trademark rules, and that's understandable. Um, but again, that's why there's lots of us that have eyes on it so that we can help you with those tricky doses and questions.
So I don't know if you're looking on TikTok.
Yeah.
I don't think they were meant to be in our chat. But Frank was like, David, you got to keep cool with them. They old, or you can stay with me, bro. It's no problem. I think he's talking about you. Um, I don't think they're right chat.
I'm not
But
sure.
David, happy to talk to you.
Yeah. What, if you got a question, let us know.
And then Nicholas was shook. So feels like I'm talking to my kids. It's great because I'm old.
Yeah. Yeah.
Let's
We
see.
are old.
What else did we have to talk about?
Let's see. I'm trying to think what else has come up recently. Let's see. We'll go through anyone starting any medication or weight loss plan. We would recommend definitely stay hydrated, add in some electrolytes daily. We also focus a lot on protein, and you can see me constantly reaching over to grab my protein shake. This is one of our favorites. Um, Neil's staying hydrated. Actually, you probably have an energy drink right now. Is that?
Neil's abusing energy drinks, and this tastes just like a Swedish fish. It's pretty amazing.
Oh, how many calories is it? Does it have a lot of sugar? Oh,
It's
okay.
1 gram of carbohydrates.
Oh, that's not.
So technically, it's 5 whole calories.
Oh, wow. Okay. I have not tried those, but
If
are
you've
they
never tried a ghost, they taste exactly like what they say on the label. They're pretty good.
okay? I'll have
Yeah.
to. I see them sometimes, but do they have as much like? Because I can't do the like the bang or yeah, the bang. I think that they sometimes like I can do a monster, but I can't do like a
Oh,
bang.
so Monster, I think is either like around 160. I think it's been a while since I looked. This is 200. So
Okay, so not much.
if you can do a Celsius, you can do this.
Okay, yeah, that's fine. I drank a bang like one time, and of course I had to suture like a face. My it was so, I was like, never again. I'll never drink that again.
Let's see, Lisa. Do you have many people that are over 65 asking for meds? I'm 68 and finally trying to get my weight under control. So excited that tirzepatide is working. We do.
Yeah,
We actually have a way more patients over 65 that I see asking for medications and doing stuff. Some over 70.
sure.
That are finally able to do something after they're tired of thinking about food or they've struggled with dieting and yo-yoing and they're just done with it. And these meds help them, whether they have a ton of weight to lose or not. Now they're just not gaining that same weight back.
Yeah, we do
You
have
know,
quite a few people that are over 65, and one of the benefits of GLP-1s in particular is that they don't interact with a lot of medications. There are medications that you have to like watch your levels of or that may need to be adjusted, although I haven't really seen a lot of medications that we've had to adjust. It's a caution that you definitely need to keep up with lab work and with your regular blood pressure and that kind of thing. But the added benefit, whereas some other weight loss medications interact with a lot of medications, and if you're on certain things you can't take those, GLP-1s don't have a tremendous amount of interactions. um, Unlike other medications, you don't have to do routine lab monitoring simply for the GLP-1. If you're on other medications that require lab monitoring, you do have to stay on top of that. But otherwise, just a GLP-1 alone, unlike other medications, there aren't any specific lab values that are impacted or have to be watched very closely, which is pretty nice.
Lisa's question goes great with Colleen's over on Facebook. What about what I hear on the news? FDA approved semaglutide reducing cardiovascular episodes. Yeah, I think it's a 30% reduction in cardiovascular risk on the medications. They're studying for strokes, heart attacks, Alzheimer's disease, like you name it, they're studying it. And I mean, really decrease that cardiovascular risk. And it's never too late,
No.
to start reducing it. I mean, especially like with Colleen, they got her cholesterol down. I'd like them to start like looking at like calcium scores, for heart attack risk prior to taking them and then
Yeah.
after taking them and see if they improve. They have to. I mean, since all the other inflammatory markers are decreasing, especially at high doses. Um, yeah, I can't wait for more and more studies to come out about these.
Yeah, I think we pulled up the graph for CRP and the
Yeah,
reduction of CRP, which is an enzyme that is elevated. It's an inflammatory marker. In particular, it is one that has some specificity towards cardiac disease and just the number and reduction. But that helps us explain, like, so many of our patients have, although it's not like FDA approved for this and there's not a lot of documentation, anecdotally, our patients are able to tell us that so many of their inflammatory disorders have greatly decreased symptoms, rheumatoid arthritis, celiac disease, PCOS. Lots of people have tremendous relief of symptoms. I mean, there's documented studies for cardiovascular and for kidney protection with GLP1s. But it'll be interesting to see in the years to come what other inflammatory issues are helped by an injection a week.
yeah, yeah. I wonder, like, since there's that huge inflammatory spike with like COVID, if this would have helped back then, like
Ooh,
people on these medications, considering that people with obesity had more trouble with COVID anyway, if this would have prevented some of that,
wow. Yeah, it's a good point. I never
you know.
Yeah, something to keep in mind, like because there will be another virus, whether it's another strain of flu or a different strain of COVID or a different strain of RSV, something like that. That would be something. I mean, all of it's based on inflammation, right? It's your lungs get inflamed, and that's how you get into respiratory distress. It'll be really interesting to see what we can use these meds for. And I get it. We sound like salespeople right now. We're not trying to sell you anything. For the record, we do not sell or manufacture or dispense any medications. We are licensed healthcare providers that assess you and your risk factors and your weight and your goals and your past medical history and decide with you on a treatment plan. But we do not sell any medication, nor do we manufacture or dispense any medication.
I mean, selling, yes and no. I'm selling you on the medication types themselves. You don't have to come to our practice. You can go see your
Yep,
doctor. You can join any other online provider. If you're not one of our states, hell, on our website, you can go and we have two other providers that we know and trust that you can use. If you're in our state, you can still use them. If you like her, the way her name sounds better,
sure.
you don't like that I'm bald. That's fine. It's not going to hurt my feelings, you know? Um, but I want everybody that can possibly know about these medicines that can help them, especially if they're young and overweight already. Like, let's keep you around for your grandkids, or
Yeah,
while you're young and you have young kids, get so you can still do stuff with them that you want to do and not be exhausted. Walk around the amusement park all day, get on a plane and go for a trip that you couldn't do before. So,
I,
so not a
I,
salesman per se.
I agree. And the other thing that makes us unique is Lee Rod's here because you are bald, Neil. We all appreciate the bald. Um, we what's interesting about us is the majority of us in our practice have taken or are taking GLP-1s. So, and we're doing this because we believe in them. And yeah, sometimes it does sound like we're salespeople, but we've just seen what a change they make in our own lives and what a change they make in the lives around us. And that it's not just the weight loss, but it is just the weight loss. Everything that the weight loss impacts. I was talking to my niece who was a patient, and she doesn't need to be anymore, but she was taking medications and she got married. A few of her bridesmaids had taken medications, and I was introducing myself to one of the bridesmaids friends, boyfriends, whatever. And he was like, I know I've heard your name. And I said, Jess, your roommate has had some recent lifestyle changes. And he said, yeah, yeah. I said, I am that Courtney. And he was like, oh, you're that Aunt Courtney. I said, I am. And he was like, he just went on and on about this person and how they had lost weight. And he was like, but you have to understand it's changed so much. She's able to be so much more outgoing. She's able to go do more things. Just her whole countenance has changed by improving her weight and improving her outlook on herself and the energy that she had. And not so many of y'all, if you've been there before, like just going to eat at a restaurant seems simple. Let me meet up with some friends at a restaurant. No, 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 no. Those of us that had food noise planned like 4 days in advance. We looked at the menu and obsessed about what we were going to order and what dessert we were going to order and planned around it and tried to, like, seriously, for like the moment we found out about that restaurant. The ability now to be like, okay, I'll go out to eat, like, probably won't eat much, but just without that obsession. and how much that changes lives. That's why we're here.
And I was telling a staff member over the weekend because she was talking about starting it, and I'm like, you're going to start because you want to lose weight. I'm like, but it's going to be so much more, and the weight's going to be a secondary thing. Like, yeah, you're still happy you've lost weight, but everything else is easier. Now you're going to be around longer.
Yeah,
So
you're going to be around longer. You're going to have more energy to, go and do things and go out and walk. And my life was led by so many years of trying to lose weight, and like our family having to like manipulate around what mom could eat based off of what mom's diet was, or I'd go on vacation and be off the rails for a while. But and then the other flip side of that, and I think if you would look at even pictures of myself, Dr. Mo, Neil, for certain, of like when we were at our heaviest, no one probably would have ever thought that we necessarily needed these medications. We weren't necessarily the picture of obesity per se. Was my BMI unhealthy? Absolutely. In opposition to that, my husband he was definitely like into the morbidly obese category. So we had me and my kids who wanted to go and do certain vacations, and there were vacations that, quite frankly, we just didn't schedule or didn't plan because we knew that he could not do those with us physically, that it would not be enjoyable for him. The ability now to like all decide together what trip we want to take or what activity we want to do, and not have to worry, one, about what mom can or can't eat and what mom can or can't do, and whether dad's going to be comfortable or not. It's like that's been life changing for certain, for our whole family, not just for us. Let's see. Anybody on TikTok with any questions?
no,
Like and share the video. Follow Neil.
please follow him.
Yeah. So that we can and then I got to apparently do a couple more lives so that I can actually invite him to be on here. But he needs more followers so that he can go live, so that you don't just have to see my face. And yeah, if you haven't followed me, go follow me. The more people that we can help and get our information out there to, we would like to be able to do that, whether it's through us or someone else. It's just life changing. Our contact is you too, Lerod. Have a great Monday. Have a great rest of your week. Our contact information is amstelehealth.com. Click on there. We have a public Facebook page, AMS Friends and Wellness Lounge. You're welcome to pop in over there, learn a little bit about us. We do have some information on our website. And if you click the button, Become a Patient, we do not charge anything until we agree that we are all a good fit. So if you want to hop on, ask questions, find out prices, and then you decide, yeah, this just isn't for me, or I just don't like the way you guys operate and work, that's okay. We will help guide you to someone else if you still want help.
Let's see.
Who else do we have?
I think that. So far, that's it. Not a lot of questions today, and that's okay.
That's okay.
Yeah, Sundays on TikTok it goes a little crazy. And I think last time, I don't think it was just me and Mo, and like it was like almost nothing till like about 60 minutes in, and then just the pouring of questions. It was pretty crazy.
That's
Like, oh
happened
my
to us
gosh.
before, where we plan on like an hour, and then like
Yeah,
right at like an hour and 2 minutes it explodes, and so we go for over 2 hours just answering questions. So chime in at any time, and if you're too shy today, we'll be back here tomorrow at 1 o'clock.
we will. Maybe something big will come up in between time. We can talk about that.
Some big news story with
Some
some
big news.
hot button fad thing about Ozempic face or Ozempic butt.
There's always some. It's just crazy because I use Medscape for like a lot of stuff, and almost every single day something pops up like an article about it. Good, bad, doesn't matter. There's
Yeah.
always something that they're either studying it for, or so Ozempic butt,
Or the people that are abusing these medications. And
that's any medication though. Any type of medication will be abused. I don't care if it's Benadryl. We've seen people come in and try to abuse Benadryl in the ER.
Yep.
It's always going to be there. So there's no way getting around that. But the majority of patients don't do that, and I don't really feel that any of our patients are doing that. I mean, we've had some people get down pretty low BMI, like to like 21, which is still within normal of the 19 to 25 or 18 to 25, whatever it is. But they're done losing weight.
Right.
and typically get to right at 21 or right above it, and they're like, I'm done. And then we start tapering off and finding that dose to keep them there, and then they slowly bump back up to right around 21 typically.
Yeah. Yeah. I had
Um,
spoke with someone today who was I was alerted that they were right around 21 BMI. And I just chimed in like, hey, tell me where you feel best. You're kind of on the low end of normal, but tell me where you feel best and what your real goals are. And as long as we're not tripping into some sort of like eating disorder or unhealthy weight, we're going to work with you. We are not a practice that is going to yank you off of your medications just because you are at a normal BMI, or, we do believe in maintenance. There's a lot of fear. People have a lot of fear of one, using these meds for maintenance, but also there's a lot of fear of people staying on them long term. I mean, these medications were created for diabetes. And obviously, a person with diabetes is going to be on a medication long term, if not lifelong. We found that they help with weight loss. So, yes, they are safe for a long time. Let's see.
that
RV
we
Wifey,
won't. Good.
I was answering RV Wifey Cheryl's question. Been on 2.5 since August 28th. Um, Tried 5 a few weeks ago and was nauseous after every meal. Well, 2.5 it is. Stick with it. If it's working, go for it.
Yeah, and lucky you that you get to stay low for so long. Some people just have to keep going up,
Yeah.
especially if it's working. Perfect.
Yeah. Absolutely.
On Facebook, this may have been discussed, but my endocrinologist says they will continue to release higher doses of Monjuro. We are not sure about that. So we have heard with the weight loss version of Zepbound when it came out that they had tested it and studied it at higher doses, and then the weight loss dosage would actually be higher. We did not see that, and I have not seen anything saying that they will be higher at this point. We do have patients at max dose that could you probably use a little bit more appetite control. So I'd anticipate it with at least Zepbound going up a little bit higher, but I guess we'll have to wait for another study or that to see.
Yeah.
But I think the glycemic control for people on Monjuro like 15 is incredible. There's always those people that are outliers that might not have good control. So we may see higher doses.
Yeah. Yeah, we may see higher doses. There are also some medications that we can add on to kind of augment the GLP-1, and some of it's one, health benefits, but also a little bit more appetite suppression if that's needed. We're pretty open to doing that and to looking at your particular risk factors, and medications and medical history, and seeing if we can add on something. We often add on metformin, which has been helpful for a lot of people.
And dirt cheap.
And yeah, and extremely cheap. Now, I would say it is not all that effective as a standalone agent for weight loss. It can be for very early diabetes as glycemic control, but by itself for weight loss, it is not all that great. That being said, probably even if I didn't need to lose weight, I'd look at all of its added health benefits for as cheap as it is. Um,
Yeah, I think you get 3 to 5%. I think weight loss with it.
yeah,
So
it's not.
it's not nothing. It's just not
No,
fantastic.
no. And there are some people that are able to like maintain their weight just on that alone.
Mhm.
Um, and it's one of those things that is also like safe for childbearing age and safe for that period in your life when you are pregnant or trying to become pregnant, which is a benefit. GLP-1s are not safe when you are trying to become pregnant, nor when you're pregnant, but metformin is. So that's
I'm gonna come back to that. Our RV wifey has lost 80 pounds at 55
wow,
years old on the lowest dose. That's incredible. I love it.
awesome. Way to go. Way to
You-
go.
you-
I'm sure you tried to lose those 80 pounds for years. So congratulations.
and I bet it was the easiest 80 pounds you ever lost.
Right, for sure.
Other than that few weeks of that 5 milligrams and the nausea.
Yeah, that's awesome.
Congrats, RV wifey. No, I was reading someone was throwing a fit on Reddit about pregnancy and the medication. Like, why won't my doctor prescribe it if I'm trying to get pregnant? Why can't, like, it's like, because it's contraindicated. No, like, first of all, you're supposed to be, you should be losing weight while you're pregnant at
Yep.
the end of the day. Like, you need the extra calories to give to the growing fetus inside you. And we don't know what this medication is going to do, to the growing baby. Is it going to restrict their fetal growth? We don't know because we don't test on women who are pregnant. So yeah, they were really upset their doctor wouldn't give it to them.
Oh,
And I'm like, yeah, a bunch of people already chimed in, so I didn't say anything. But
yeah.
it's like, yeah, no, I wouldn't either. That's
No, I mean, first do no harm, right? Like to you or to the unborn child. Like, let's not. No one wants to have any adverse effects.
Which is weird because I have patients come to the ER and they have like a urinary tract infections, and the biggest, they're breastfeeding or they're pregnant and they're freaking out. Like, they're safe, baby safe. They don't want to take an antibiotic on an infection that can make them very, very sick and potentially get septic and die. But meanwhile, someone wants to lose weight. It's like, and then that doesn't care about like what they're saying. Like, you can't do that.
Yeah, I get it. I get it. It's super hard when you already struggle with your weight to be in a pregnant state where you're told to like gain weight or, definitely not worry about losing weight. It's a weird phenomena. It's a tricky time.
I'm sure it is, and I have never been there, so I guess I can't comment on it. But it's just like your doctor's telling you this.
I know during my twin pregnancy, I had gestational diabetes, so I needed to watch my glucose, but I also needed to get in 3,600 calories a day to support two growing fetuses. Man, that was hard. I learned how to trick the glycemic index really well. It's the only way that I could get in that amount of calories was with some sugar and some protein shakes and stuff, which some of them
Yeah.
were higher in sugar, but I just I take it with a scoop of peanut butter, or I would make sure that I had like a handful of nuts with a cookie to make sure that I didn't spike too high.
Rachel on Facebook was saying today was her first dose of 15. Congrats for getting to there. Hope it's still working incredibly well for you. And then, do you add metformin for non-diabetics? Yes.
Hmm.
Yep. A lot of times metformin is used for PCOS is like the first line treatment. It works for some people, like mostly it doesn't. But it's the best we had up until these medications. The Mounjaro, tirzepatide, Zepbound does incredibly well for PCOS. But yeah, we'll add it on. It helps with appetite control, glucose absorption. It's supposed to help with longevity and some other stuff, Alzheimer's, and so it has other benefits. So even patients that are like lost their weight and are coming back down are usually staying on the metformin.
Yeah, it's so inexpensive, and if you just type in like benefits of metformin on Google, you're going to come up with so many articles of all of these added health benefits for something that is, I mean, less than for most people less than $10 a month. For a lot of people, less than $5 a month.
It might be free.
Yeah, I mean, mine's always a different price, oddly, but like I can get a 30-day supply for I don't know 486, but then and sometimes they dispense weird amounts. Sometimes Neil helps me with this. But he prescribes like the same amount every time. And sometimes they give me a 30-day supply, sometimes a 60-day supply, sometimes a 90-day supply. And it's a different price every time, but it's never expensive. I don't know why. I'm like, I can see how this was prescribed. I know what
Yeah,
it is. Whatever.
yeah,
Supply.
it's prescribed the same every time.
I know. I don't know. Like we're just clicking refill. I get it. All right, we are winding down on time. Anybody have any last minute questions?
And if you think about them after we get off, feel free to either message us
Yep.
or we'll be here tomorrow.
Yep. We'll be
We'll
here tomorrow. If
do it again.
yeah, if later on today you have a question, Neil and I will be here tomorrow at 1 o'clock while Dr. Mo takes a much needed vacation and rest time. Neil and I will hold down the fort with the rest of the AMS crew.
She is on spring break. I'm not sure if she's in Fort Lauderdale or Miami or South Padre, really having a good time or what, but
She is not anywhere warm. She took a
I know.
cold spring break vacation this year. So that'll be interesting. Have a
Stacy,
good
have a
day,
great day.
Stacy. Thank you.
All
All
right.
right,
Let me
guys.
see. I think that's it. All right. We'll see everybody
All right.
tomorrow,
See you guys
same
tomorrow.
time.
All right. Thanks, guys. Thanks for chiming in. See you tomorrow.
Bye, guys.
Now I got to figure out how to turn this off.
To stop the live on this side.